So you're pregnant. Now what? What do you do? What do you need to know to prepare for the total 40 weeks of pregnancy? This episode, we hope to kind of give you the quick and dirty on the big, most important things to help you have a safe and healthy pregnancy.
Yep, and in case you missed it, we shared some pretty big news last week ourselves. We are also having a baby.
Yes, number 3. And so we are going to be bringing you that week by week medical information about pregnancy and fetal development, as well as updates as we actually live it again.
And just in case this is your first time meeting us, I'm Kurt, I'm a board certified pediatrician.
I'm Sarah, I'm a board certified OBGYN.
And we are the Doctors Bjorkman. As we mentioned, we are going week by week through pregnancy, and this episode is all about the things you can do to have a healthy pregnancy and changes you can make in your day-to-day life to help your developing baby be as healthy as possible while also keeping your own sanity amidst all the recommendations you might be hearing.
Yes. So to start this episode, we're going to talk about some of the signs and symptoms of early pregnancy. A lot of women won't start noticing these until about 1 to 2 weeks after their missed period, but some are a bit more sensitive and start to notice them sooner. So these are things like breast fullness, nausea, frequent urination, fatigue, moodiness, and bloating. These are all from those increased hormone levels that you are starting to experience. One of the most common frequent thing noticed is kind of this women notice like their breast changes. And that tenderness often goes away as your body adjusts to those hormones of pregnancy. First trimester fatigue can also be pretty extreme for some women, but that also usually goes away in the second trimester. So my recommendation to patients is to listen to your body, go to bed earlier, take a nap. Getting the rest you need is really important, and your energy will come back and you will be able to exercise again and stay awake past 8 o'clock at night.
Yeah. Now, another common symptom in the first trimester is nausea. Often called morning sickness, pregnancy-associated nausea usually starts between weeks 4 and 9.
Yeah.
It's actually experienced by somewhere between 70 and 80% of women during pregnancy.
Yep.
Now, given this is such an incredibly common and sometimes debilitating issue, we're going to give more attention to this topic with a whole episode in the upcoming weeks.
Yep.
In the meantime, if you're having trouble with nausea, getting enough nutrition in, staying hydrated, please talk to your OBGYN right away.
Yes.
But speaking about nausea, we really also need to talk about diet.
A big myth about pregnancy is that as mom, you are now eating for 2. And unfortunately, this mindset can very quickly get you into trouble with excess weight gain. In all honesty, a pregnant woman with a normal weight, a BMI at the beginning, really only needs to eat between 300 and 400 extra calories per day. And that increase doesn't really start to be necessary until the second and third trimesters. You will most certainly gain weight during pregnancy though, and that is important and healthy.
Yeah. Now, on average, that weight gain during pregnancy really depends on where you're starting. If you're underweight to begin with, the average weight gain should be somewhere between 28 and 40 pounds. If you are a normal, healthy weight, the average weight gain expected is 25 to 35 pounds. If you're overweight, maybe less, 15 to 25 pounds, or if you're obese, 10 to 20 pounds. Cool. That really is about 1 pound per week, not starting until the second trimester.
Yeah.
Now, there may be no true pregnancy-associated weight gain in that first trimester at all.
Yeah, and sometimes that makes patients nervous in that first trimester. They are nauseous and not eating and throwing up, and they lose weight or they don't gain any weight. And that's okay. And some people gain some weight in the first trimester, and that's also okay. It's just something to keep an eye on as you're going through.
Yeah, so then the question is, where does all that weight gain come from?
Yes, so by the end of an average healthy pregnancy, this kind of looks something like this. So 7.5-ish pounds of baby, 2 pounds of amniotic fluid, 1.5 pounds of placenta, 2 pounds from the increase in size of the uterus to hold that baby, 2 pounds from increased breast tissue, 4 pounds of increased body fluids, and 4 pounds of increased blood volume as well. There's only about 7 pounds of increased maternal stores of fat, protein, and other nutrients.
Yeah. Now, regardless of weight gain, however, there are most certainly some nutrients you want to make sure are part of your normal daily diet.
Yeah.
This includes things like folic acid, 400 micrograms, 27 milligrams of iron, 1,000 milligrams of calcium, and about 600 IUs of vitamin D daily. And the easiest way to make sure you're getting enough is just by continuing that prenatal vitamin that hopefully you started before you even started trying to get pregnant.
Yep.
And if not already taking one of those daily vitamins, start now, in addition to eating a well-rounded and balanced diet.
In terms of diet, there are a couple foods you should be aware of because they could put your baby at risk. So these are high mercury fish.
Yeah, so think about like swordfish, king mackerel, marlin, orange roughy, tilefish, shark, big fish.
That eat other little fish,
Yeah.
yes. You want to avoid all raw or undercooked seafood, eggs, and meat.
Yeah, so sorry to those sushi and steak tartare lovers out there.
Yes, and sometime we can go into like some of the thoughts on sushi and flash freezing and different things, but general to be ultimately safe, we say, hey, maybe skip that. Same with deli meats and hot dogs. There is this risk of listeria, so we say avoid those unless you heat them to steaming.
Yeah. Also avoiding those like soft, smelly, unpasteurized cheeses, things like brie, gorgonzola come to mind.
Yes, most things in the United States are all pasteurized, so just make sure, and then you're good to go. Same thing with unpasteurized milk or fruit juices. Want to skip those.
And then being sure to wash all fresh fruits and vegetables as well, just making sure that the things you're putting in your body are at low risk for giving you an infection.
Correct. So with all of this, keep in mind that some of these recommendations are fairly new, and many healthy pregnancies around the world have been carried to term without issue despite mom eating some of these foods. So we just want you to know that there are potential risks with each of these to think about.
Yep, and if you've already done one of these things once, like, it's okay, don't freak out. You don't need to call your OBGYN right away.
Yes. So the other thing we're thinking about for all of you is you want a well-balanced diet that is rich in vegetables, fruits, whole grains, and lean proteins. It's great to vary your sources of protein, so consider having 2 servings of fish a week. Again, those low mercury seafood things like shrimp, salmon, tilapia. A little caffeine is also okay. You do not have to completely quit that coffee habit.
Yeah, well, this means it's totally okay for you to have that 1 cup of coffee in the morning, really thinking about a goal of up to 200 milligrams a day.
Yes. So overall, healthy eating is really important as that nutritional intake is responsible for nourishing both mom and a growing baby.
Yeah. Now, next to eating healthy is staying active, which brings us to one of our favorite topics, and one that we're going to actually spend some more time in the future with in an additional episode, all about exercise and pregnancy.
Yes.
Exercise has so many amazing benefits, both for mom and that developing baby when done properly.
Yep.
The goal is 30 minutes of exercise 3 to 5 times a week doing pregnancy-safe activities. And so if you've got questions about this, be sure to talk with your OBGYN about what is best for you. But a good rule of thumb is that you should be able to carry on a conversation while doing your workout. Okay, so you're pregnant or your partner's pregnant and you're weeding through all this information about what to do and how to be healthy during pregnancy, looking for a great resource. We actually loved a book put out by the American College of Obstetrics and Gynecologists called Your Pregnancy and Childbirth Month by Month, a really solid resource just of all of the formal recommendations of what to be doing during pregnancy. We'll link that for you guys. Another great book that Sarah was actually the medical editor for, goes week by week through pregnancy with a lot of just down to earth, like what's going on with mom's body, what's going on with the developing baby, how do you get ready for childbirth, all of these things. It's called Becoming Mama. We really loved this. Of course, Sarah was involved in it. Check it out as well. And then maybe you want to go to the next level. Maybe it's baby number 2 or 3. You're like, hey, what is actually the evidence behind all of this? How much of this does it actually matter? What is the real world effect of these things. We also loved a book Sarah will probably talk about in real life later, called Expecting Better by Emily Oster. Really just kind of dives into a lot of that detail if you're looking for the next level. Another question we get a bunch is like, hey, what should the partner be doing during pregnancy? There was actually a video a while ago we put out where we said, hey, we're pregnant. And of course there's a lot of ick when the guy says, oh, we're pregnant, because obviously I don't physically have a human developing inside my stomach. And so of course, like the changes that go on through pregnancy, about like all of the body changes and just the burden of growing a new human, does not rely on me as the partner. However, I really encourage people, like, if you can, like, treat it as a we thing, right? If you're the partner, like, hey, what things can you be doing to make things better for you as a team? Start taking ownership for this. And so now for us, we've got 2 little ones running around. Sarah's got the first trimester fatigue, and so I'm like, hey, I know that I need to pick up extra slack because her body's going through some amazing changes right now. Thinking about how important exercise and staying active is. Like, what are things I can do to be active myself, to be a healthy dad, but also really encouraging like Sarah to be able to have the time to go exercise, to stay active, because it's so good for her health, for the health of a developing baby. So again, right, Sarah's pregnant, but also like we are pregnant as partners, stepping up to the bar to say, hey, how can I help my partner through her pregnancy as she is growing a new human?
Another quick list we need to be sure to share with you are some non-food things to avoid during pregnancy. So some of these are pretty obvious, like smoking, which has been shown to increase the risk of vaginal bleeding, preterm birth or stillbirth, as well as low birth weight and sudden infant death syndrome. So no smoking.
Yeah. Alcohol and other substances like marijuana, cocaine, methamphetamines can cause problems for baby as well, with issues like preterm birth, interference with their growth, causing birth defects, or even learning behavioral problems later in life.
Yep.
If you are struggling with substance abuse of any kind, you can call 1-800-662-HELP. And if you're looking to quit smoking, you could also call 1-800-QUIT-NOW for help.
Some other less obvious things include cleaning cat litter boxes, as cat feces can carry a parasite called Toxoplasma gondii that, while usually harmless, can potentially cause miscarriages or other infections in pregnancy. There's a caveat that we're going to talk about here. So a pregnant woman is not likely to get infected with this via skin-to-skin contact. It's more likely via consumption, like
somehow that feces get into your
infected
mouth.
the cat feces.
Yeah.
Yes.
But the good news is that the odds your cat has this parasite is actually quite small, especially if they're an indoor cat.
Right.
But if your cat is an outdoor going one, it does pay to be extra cautious. Things like wearing gloves if you have to clean out the litter. But honestly, if you can, get someone else to do it for you and help you out.
Indeed. You may have heard that you need to avoid hot tubs, hot baths, or saunas, but these are actually okay as long as you limit your time to 10 minutes or less. You just don't want to raise your core body temperature for a long time.
Now, sometime during pregnancy, you are likely to have a headache or other aches and pains.
For sure.
Tylenol or acetaminophen is going to be the pain reliever of choice. Other medications, common NSAIDs like ibuprofen, Motrin, Advil, Aleve.
Naproxen, yeah.
These are not good to use because they're not good for babies developing kidneys or other parts of their heart, actually. So please avoid these if at all possible.
Also, that hormone progesterone that we have talked about will slow everything down. That's just what it does. So your digestion, your bowels, all going to slow down a bit. So be prepared for some potential heartburn or constipation. Tums or Maalox are totally safe. And you can pick your favorite stool softener like Miralax or Colis or Metamucil to have on hand. If you get a cold with a cough, Robitussin is okay to use. So all of these recommendations are out there to try to minimize as many risks as possible to you and to baby. And so I certainly will say that some of my, people ask me, well, what do you do as an OBGYN? And definitely it has changed. Some of my concern about risk has gotten more lax as the pregnancies go on. Even, in your first pregnancy, when someone asks you how far along you are, you're like, I'm 12 weeks and 3 days. And this pregnancy, someone asked me, how far along are you? And I'm like, we're in the first trimester somewhere. So anyway, things I do in terms of these hot topics. One note I will say here is I read a book. It's called Expecting Better by Emily Oster. She's an economics professor, and she really kind of does a deep dive into all of the data and research that is out there on alcohol, caffeine, deli meats, exercise, all of the things. So if you want to also do a deep dive, it's a easy read. It's very interesting, and of course, she is looking at this, from an economics professor lens, not as a doctor might perhaps, but it's an interesting, different perspective that evaluates some of the risk in a different way, and I enjoyed that. So, the things, deli meats, I definitely, less with baby number one, but certainly now we'll have a turkey sandwich once in a while. The last listeria outbreak was in like Bluebell ice cream was a big one. That's going to be the one that gets me. Spinach, carrot. You can't control all risk. And again, risks are low, but still there. So again, you're weighing how much risk do you want to avoid. When I remember being a resident in training and we'd have our diabetics who needed to eat protein and all they could eat was a cold cut. And we'd say, well, that's what you need to do. Don't, eat stuff that's been sitting out for an hour or that, you get at the gas station. But anyway, other things, coffee, definitely. I'm not a big coffee drinker. I like some tea or a pink drink once in a while. And I think that is very safe and reassuring if, you're staying under 200 milligrams of caffeine, certainly. What else? Alcohol. We know there is no safe amount of alcohol in pregnancy. We can't study it, so we don't know what that is. We know binge drinking is bad. We know it causes birth defects. It causes fetal alcohol syndrome. There aren't really a lot of health benefits. There are 0 health benefits for alcohol, essentially, right? So that being said, there is data out there, observational data of women in other countries, in Europe, in Australia, who have drank during their pregnancies, and they have studied those outcomes. And she does go through this a lot in the book. And so my sister got married, and for her toast, I had a half a glass of champagne and feel very comfortable knowing that baby is going to be fine. So what else? I think that, if I had a cat, which we do not, I would have Kurt clean the litter box. Not because there's any data for that. If your cat stays inside, the chance of toxo is really super minimal. But I'd say that sounds like 9 months for you, dear. I think the thing, if I could recommend to you today, you've just found out you're pregnant. You are, it is exciting and overwhelming and all of the feelings. I would say you can do this. Think about how you feel about risk. And some people want to avoid absolutely everything, and that's great. You know your heart. And some people want to live on the edge and eat a turkey sandwich or get sushi at a super nice restaurant that has been flash frozen. So it's all about how you feel about risk. And that's great. One other thing I will say, if I could encourage you at the beginning of your pregnancy here, or whenever you find this, is keep moving your body, keep exercising. It is one of the best things that you can do for your pregnancy. It's one of the things that was very different between my first and second and third pregnancies. In my first pregnancy, kind of at the end, I think I was studying for a board exam and like sitting at my desk for hours a day and not going to the gym like I previously had. And I had bad like pelvic girdle pain, symphysis pubis dysfunction. I was seeing a chiropractor to try to, get my pelvis to do what it was supposed to. And it was tough. I couldn't tie my shoes, or it was hard to walk upstairs. So my second pregnancy, I really made, and I know all the benefits of it, right? Life happens. And so sometimes we have great intentions and you can't accomplish those things. And so you give yourself grace and you do the best you can. Second pregnancy did so much better in terms of exercise, resistance training, lifting weight, and had a way better pregnancy, way better recovery. If I tell my patients, if I could prescribe you one thing during your pregnancy, it would be to exercise. You will have a better pregnancy, you will have less low back pain, you will have a better delivery, you will have a better postpartum recovery. Exercise is amazing. And so if you have questions about that, talk to your OB. I did a program. It's called +1. Meg Squats does it. She's an amazing power lifter who was also pregnant and developed this awesome program. I helped with it a little bit for some of the OB stuff. But, people say, oh, don't lift more than 30 pounds when you're pregnant. But at the same time, I'm hauling my 3-year-old toddler and the 1.5-year-old baby around up and down the steps, and that's fine. So you need to train for life. And I again, love exercise, do it as much as you can. Balancing that with first trimester, you're just trying to survive. And so your energy will come back. You will be hopefully able to eat again. So give yourself grace and know that it is a wild ride. You can do it. We are here to help you have the best, healthy, strong pregnancy that you can. So thanks for being here with us for number 3. We want to remind you that pregnancy is really overall usually a state of wellness. It's certainly not health neutral, but generally a state of wellness. And so even though I'm pregnant, I can still do just about everything I used to before. I just remember, hey, everything I'm doing to body now is affecting not just me, but this little growing babe.
Yeah. So with that, we will plan to see you next week for more as we go through our week-to-week guide through pregnancy. Hopefully you're doing well, and we'll see you soon. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.
Should we talk? Should we tell them some stuff? So, pregnancy is certainly a life-changing event, both for you during pregnancy and then for after, definitely. But I try to remember, hey, this is a state of wellness. You can keep doing...
Sorry, Mom.
It's okay, baby.
Yeah, Mommy.
It's okay.
Yeah, Mommy.
Most of the time.
Yeah, Mommy.
It's okay.
Yeah, Mommy. Yeah, Mommy.
Yeah, what's Dad doing, Bo? What's he out there doing?
Vacuuming.
What's he vacuuming, see?
His pee.
Yeah, did Bowie pee on the floor?
Yes.
Yes.
On the carpet.
On the carpet. So Dad's vacuuming that up, hey?
Hey.
Okay.
I don't want to boy milk of it.
Whoop.
I don't
Yep, set that up.
Boo-boo.
You got a boo-boo?
Yeah.
So this is certainly in real life